I'm going to talk to you guys today about an ankle-foot orthosis. Now this is an ankle-foot orthosis, and as you can see, you could put your foot in here, and then you've got some Velcro hinges around the lower part of the leg. On the bottom of this, you've got a nice, soft, cushiony plastizote material. Now this helps make the orthotic more comfortable. It also helps to protect the skin because that skin in your feet can become very, very sensitive and thin whenever you have some nerve damage there. So this is going to protect that from wear and tear and make sure that you don't get any wounds or issues with the skin that you don't want there. Now, why would one of our patients want to wear something like this? Well, it's going to help with your balance, and a lot of people that have nerve damage are going to start to have some negative effects on their balance. It makes sense. If you don't feel the ground under your feet as well as you once did, then you're not going to quite know where everything is. You're not going to know where your feet are in space as well as you used to because you're just not feeling them as well anymore. And of course, those slips and falls can lead to other types of injuries, which we don't want for you either. The other thing is because this has a hinge part right here, this is going to help pull up the toes. And that's important because a lot of times when people have nerve damage, they're going to start to take different types of steps. It affects your gait, and that causes you to use the muscles very differently than you normally would. Now that can cause a lot of achiness when you're walking around during the day. It can also cause achiness at night when you sit down and you're trying to rest and relax. There's some muscles on the bottom of your feet, the back of your leg, and the front of your shins that are all going to get very tired and sore whenever you start to walk like that. Now you might not be noticing those things yet, but as we start to repair the function of your nerves, you might start to notice those a lot more, and they can become very uncomfortable if they aren't already. The main reason is we want you to be able to maintain your quality of life. We want to make sure that you can do all the things that you want to do without having that extra achiness or soreness, and that you're not risking falling and causing yourself other injuries. These are covered by most insurance companies. And the reason is that the insurance companies know when there's a neuropathy and damage to the nerves in the feet that you need to use those feet a lot more to maintain the function of the nerves that you still have left. I mean, it makes sense. If your feet hurt, you're not going to want to walk more on them. You're going to want to rest them more and get off of them. But the less you use your feet, the faster the progression of the nerve damage and the disease. So we need to make sure that you can maintain your activity levels, maintain your quality of life, and do the things that you want to do without risk. Now, one of the main concerns that I hear from a patient when we start to talk about something like this is they don't like the way it looks, or they don't think it'll fit in certain shoes or things like that. Well, you don't have to wear it all the time. Just because you have it doesn't mean that you're tied to it for the rest of your life. I want it to be there for you when you need it. So if you have a special event, a nice occasion where you're going to wear some different shoes, then you wouldn't necessarily need to wear that orthotic to that event. But if you know you're going to be walking a lot on a particular day, afraid you might fall, or afraid that your feet are going to get tired and sore and achy and not allow you to do the things that you want to do, then that's the time that you're going to want to have this there for you when you need it. The best thing that you can do is talk to your doctor if any of those things that we just mentioned concern you or have been a problem for you in the past. Your doctor can cover whether that would be a beneficial part of the treatment plan for you, and also they can talk to you about what your particular insurance plan would cover for you on that and if there's any out-of-pocket cost involved.